Hello everyone, I'm Naveen Agarwal, and today I want to demonstrate the BinaxNOW antigen self-test for detection of COVID-19. Now, this test recently became available over the counter without a doctor's prescription, so I went looking for it in my local Walgreens store. Now, I don't know if it was that specific store or this is a general issue, but I was not able to locate this test very easily in the store, and I had to go talk to the pharmacist. And it was behind that counter that I was able to find it. But no problem, I was able to get it. No prescription needed. So very easy. Now I went looking for it because I'm interested in learning more about how these tests actually work. If you have been following my YouTube channel, you know I have been interested in COVID tests for a very long time. I have reviewed many different types of tests that have been authorized by the FDA. But so far, I looked at only data, what I call paperwork, no real world experience. But now that these tests are becoming available, I want to try them out. The intent here is to learn and share that learning with you. Before I go any further, let me tell you that I do not have any relationship with this company or any other company that is making these types of tests. So my purpose here is not to promote one product versus the other product. No, the purpose here is to learn together and share that learning with you. Now, for me personally, I do not have any reason to believe that this will give me a positive result. I'm fully vaccinated. I don't have any symptoms, and I have not been in contact with anybody who has been confirmed positive for COVID. But you might find yourself in a situation and a reason to do this test. Maybe you are traveling and they require it, or maybe you have some symptoms, or maybe you think you came in contact with somebody. Whatever the reason might be, you might want to do a test like this. So maybe it will help you, hopefully. I will be very interested in hearing back from you, your questions or comments. So make sure you subscribe to this channel, engage with me here or on LinkedIn, and we will continue to talk about this. So having said that, we will do it together. But more importantly, we will figure out and understand what the results might mean and what should be your next steps, whether you are negative or positive. We will talk about that. And again, we will do it together. So before we start, let me emphasize that this is an antigen test, not a PCR or PCR type test. That's a big difference. Antigen tests detect the presence of an antigen or a protein which surrounds the genetic material, the RNA of the virus. It doesn't detect the RNA directly. That's a little bit indirect test. The positive is it can be fast and quick and relatively inexpensive. The negative is it's not as accurate as a PCR or PCR type test, which directly detects the RNA material. Now, I have reviewed another PCR type test called Lucira at-home COVID-19 test, and there's a video on my YouTube channel. You can find it there. But again, I'm not trying to endorse one product versus another product. Both types have their own place, advantages and disadvantages. This just happens to be a rapid antigen test. Okay, so make sure you look at the box. There are two tests here, not one, and we will talk about why they have given you two tests. It's not just that you're getting two for the price of one. No, there's a reason why you might have to do both tests, and we will talk about that. But before we go, make sure you wash your hands, which I have done. It's always best to have these disinfectant wipes handy. And I like to make sure that my surfaces are clean where I'm gonna use the test. Make sure it's a stable surface, not a wobbly table. If you have symptoms and you are really in bad shape, you might want to get some help from a family member because this may not be very easy. Okay, so we will wipe it, just wipe the hands a little bit. Let's wipe the box as well before we open it. Okay, then we will throw it. Okay, so in the box, we will open it. We have COVID-19 AG. This is probably the COVID card inside that. There are two of them. Again, there are two tests. So we're going to set one pair aside. We have two swabs. Okay, we'll take one aside here. It's just a tray, so we can reject that. Okay, let's see. So we'll see what it is by looking at the instructions, probably the reagent, the liquid reagent. Again, we'll set one aside. Nothing else. All right. Now, very important to read the instructions before you start. Unlike, piece of electronic or IKEA furniture where you can refer to the directions as you go. It's important to read them and read them completely before you start. They have one in Spanish. Now, if you are Spanish speaking, you can use this. This is in English, so we will read this. So, lot of fine print. There's a lot of information here. I will summarize that for you as we go along. Intended uses for detection of COVID-19. You may or may not have symptoms. You don't need a doctor's prescription. It is not a molecular test. It's not a PCR type molecular test. How accurate is the test? We will discuss that more in detail towards the end of the test. And they talk about serial testing. Serial testing meaning one after the other within a couple of days. That's why they have given you 2 tests. We'll talk about why you may need to do that. There are a lot of precautions and warnings here. Storage might be important. Do not let it sit outside in the heat or extreme cold. They are saying 35 to 86 degrees Fahrenheit, normal room temperature, 2 to 30 degrees C, or you can put it in the refrigerator, not in the freezer, in the refrigerator for a while. They tell you what the positive results mean, what the negative results mean, and what's an invalid result. So we will look into that. Here they are telling us what they have in the package. So we have the swab. Yep, we got it. We have the test card in the pouch. It's a sealed pouch. We got that. Dropper bottles. So this looks like you could have a bottle or a dropper. So we got like a dropper here. And they will tell you showing you the outside of the card. So let's go ahead and open this. Okay, so we can open this here. All right, so this is what the front of the card looks like. We make it very close to it. You notice that blue line. That blue line is important, and that's where the result will be shown. Positive, negative, and there is a barcode here. That will be important for you for the purpose of reporting the result. Now if we open it, we're going to open it like this, and you have to lay it flat on a surface. So there are 2 holes, bottom hole and the top hole. Each one has its purpose. We're going to talk about that. Okay, so we will lay it flat on the table. Let's see what we have on the other side. All right, so instructions start here. Before starting, wash or sanitize hands. We did that. Be prepared for the test. We have everything. Timing device. So I'm just going to use my timer on the cell phone. Card must lay flat on table for the entire test. So we're gonna open this a little bit and make sure this stays flat. And I want to make sure you can see it in the video. So let me move this a little bit. And let me do this right now. Okay, so you will be able to see this. This must remain flat. Okay. I will turn this around when we have completed the steps. We have removed the card from the pouch. Blue control line is present in the result window. We saw that, right? This is the blue control line. If not, don't use this card. Okay? Open the card, lay it flat. We did that. Remove dropper bottle cap. Hold dropper bottle straight over top hole, not at an angle. So at the top hole, we will have to drop about 6 drops here. So we will do that. Do not touch the card with the tip because we don't want to contaminate anything. Then it asks you to open the swab package at stick end. We're not going to touch the tip. Swab both nostrils carefully, up to 3/4 of an inch. So you don't have to take it all the way up, maybe just halfway, 3/4 of an inch. Now, I like in the other test that I reviewed the other day, that direction was a little bit better that, take it up when you meet some resistance. And we're going to do that. Using medium pressure, rub the swab against all of your inside walls of the nostril 5 times, 5 big circles. Each nostril must be swabbed for about 15 seconds. So we will do it in each nostril. Top. Did you swab both nostrils? They want you to swab both nostrils. We will check that. Then we have to insert the swab into the bottom hole. So again, I will show you. You have the top hole and the bottom hole. And in the top hole, remember we already dropped 6 drops. And in the bottom hole, we will insert the swab. Finally, push the swab tip from the bottom hole until it is visible in the top hole. We want to make sure that it goes all the way into the top hole. Do not remove the swab from the card. Turn swab to right 3 times to mix the swab with the drops. 3 times. Do not skip this step. If you do not rotate the swabs, the sample will not go into the liquid. Leave the swab in the card for the remainder of the test. We don't have to take it out. Note, false negative result can occur if swab is not turned. If you don't turn, you can get a false negative. Do not remove the swab. Now, there is an adhesive liner here. This is the adhesive liner. We will peel that off. And then you have to close left side of the card over the swab. Left side. Do not move this side because it has liquid in it. Left side, you just close it on top of it. Keep card face up on the table. Wait 15 minutes. Read the result at 15 minutes. Do not read the result before 15 minutes or after 30 minutes. What does it mean? If you don't get a positive result in 15 minutes, maybe we need to wait 30 minutes. That's how I read it. So 15 or 30. If you get a positive result, fine. If you don't have a positive result in 15, you should continue probably until 30 minutes, but not after 30 minutes. Results should not be read after 30 minutes. Don't leave it and walk away. So we will time it. We will check at 15 minutes and we'll also check at 30 minutes. Now we check for positive COVID-19 result. Okay, so positive will be if you see 2 pink purple lines, one on the top half and one on the bottom half. This means COVID was detected. Look very closely. The bottom line can be very faint. Any pink purple line visible here is a positive result. So it should be both top and the bottom. And they have given you some example of what that might look. They have given you some examples. Check for negative COVID-19 result. Find result window and look for a single pink purple line in the window. That, remember there was blue line. That should turn into, at the top, a purple line. That shows that the test has worked properly. That's a control line. If that is pink or purple, but not the bottom line, you are negative. But if both lines are positive, are pink, then you are positive. Now, if you see any of these results, just a blue line, no sample line, no line seen, pink purple sample line only, blue control line and pink purple sample line, those are invalid results, and contact technical support. You can throw away all used test kit components in the trash. Report your results. Please share your test result with your healthcare provider. A second test should be obtained over 3 days with at least 36 hours between tests. That's why they've given you 2 different tests. And we'll talk more about that. Why you may have to do that. Okay, so I think so far so clear. Let's do it. All right, so we will make sure it lays flat on the surface. We are gonna break this open. And take this garbage can. Okay, so we have to do 6 drops on the top hole. So we're gonna count this. Yes, you can see it. Do not touch the tip. One, 2, 3, 4, 5, 6. So I got 6 drops in. We're gonna set it aside. Okay, take a deep breath. Make sure you are relaxed. Keep a box of tissue handy in case a sneeze comes. And again, if you are feeling sick and have symptoms, make sure you have somebody to help you. All right, so we're gonna open this swab without touching the tip. Make sure you don't touch the tip. So let's see. Yes. All right. So it's a good thing that it opens from the bottom. So here, we're just gonna pull it out. Pull it out like this. We're not touching the tip right here. And we're gonna do it in every nostril at least 5 times. Okay. So here you go. 1, 2, 3, 4, 5. You have to do it quickly. Other one. 1, 2, 3, 4, 5. Okay. All right. So now we're gonna insert this in the bottom hole and push this in until you can see it at the top. Okay. Okay, so we're gonna insert. So it is, I'm able to see it in the top hole. Now, make sure you rotate it 3 times. 1, 2, and 3. We rotated this. And now we are going to close this using the left side. First, we have to remove this adhesive layer. And then we close this and press it tight. And we're gonna leave it flat on the table, and we're gonna set the timer for 30 minutes, and we're gonna monitor in 15 minutes. So the timer is set. We're gonna come back and check in 15 minutes where we are. So we are looking at how the liquid is moving on this strip. As you can see, it is moving towards that blue line. And we see a little bit of a pink color emerging. And it is pushing that blue line up and up. So we will see if that eventually the top line should turn purple or pink. Seems to be working fine because the liquid is moving, and we are beginning to see that blue line disappear. So we are about 5 minutes into this test. Just wanted to take a quick look what's going on. Let me zoom into the card and see what is going on there. So if I look into this card right now, the top blue line has completely disappeared, and it is beginning to look like it's turning into slightly pink line about halfway there. So so far so good, because the control line should be a little bit turning pink or purple. And as it is shown on this card, you see if both lines are pink and purple, then you're positive. If the top line is pink or purple and there is no color change on the bottom sample line, then you are negative. So again, we will keep monitoring it and come back and check at the 15-minute mark. So we are close to our 15-minute mark, and so far I see only the top line as kind of pink and purple. I will take a close-up look of it, a video and a photograph, to see exactly what it looks like. So we are seeing now that after 15 minutes of waiting, the control line at the top is kind of pink. Half of it is pink, other half is a kind of faint pink. And there is no color change at the bottom sample line. So this is a negative result according to the instructions for use. We will continue monitoring it for the full 30 minutes to see if there is any change. So after waiting for 15 minutes, we are now seeing that the positive control line at the top has kind of turned pink, and half of it is very clearly pink, the other half is kind of faint, but there is no color change on the negative, on the lower sample line. So that would mean that this result is a negative result, but we'll continue to wait for the entire 30 minutes and come back and see if there's any change. So we are just about 30 seconds away from our 30-minute time, and still it's the same result. The top control line is half purple very prominently, and half of it is kind of faint. The bottom sample line doesn't show any color change. So it is a final negative result. So let's cancel this timer. And what you want to do after this test is over is make sure that you take a picture of it and share with your doctor. And here we will just write the name and the date. Because according to the instructions, you are supposed to share that with your healthcare provider. So we will just take a picture. Let's just do a picture this way, and also make sure you take a picture of the box. Maybe that gives them a little bit more information about, the details of that particular box. And at the back of the box, there is a barcode that you can include in your picture and share that with your healthcare provider. So, and at the end of it, we will just throw it in the garbage. So let's talk a little bit about what the test might mean. In this case, as we expected, a negative result, we found a negative result. Now, there are only two outcomes, positive or negative. And there are two possible scenarios. Either you are really positive or you are really negative. So really, it comes out to 4 different combinations. The data is showing whatever data they have submitted to the FDA as part of this specific authorization for at-home use. Small number of samples, but they are showing at 95% confidence, about 73% to 98% chance that a positive result is really confirming a positive diagnosis. So it's a range, but the sample size is small. So anywhere around 80-85% confidence that a positive result is positive. But there's a chance that a positive result is actually a false positive. And there are many reports of false positive results from rapid antigen tests. I hear that routinely from my viewers on YouTube channel. So don't be surprised if you get a positive result and you say, I don't have any symptoms. Why is it a positive result? That is why they recommend do a second test. Now, in their instructions for use, the second test is definitely recommended if you come out negative at first. Okay, do the second test. But I would say even if you're coming out positive, do the second test. And the second test should be done within 3 days with at least 36 hours between the two tests. So roughly about 36 hours of duration, do the second test. That second test will confirm with a higher level of confidence whether you are positive or negative. And I have made a video on how the math works. Now I can give you a link to that video. First test positive, second test positive. What are the chances of you being positive? Very, very high. First test positive, second test negative. What are the chances of you being actually negative? Somewhere in between. Same thing, first test negative, second test negative. You being negative is very, very high. That's why the second confirmatory test is required. And that's why the FDA is strongly recommending serial testing. And that is why they have given you 2 tests in the same box. So again, a lot of details to keep track of, especially when you are trying to figure out what is going on. But bottom line, make sure you share the results with your doctor and ask them what the results might mean in your specific situation, given your personal medical history and the history of exposure, because they are your best source to figure out what your results mean and what you should be doing next. There's a lot of information in this instruction for use, what you should be doing if it is positive. Even if it might be a false positive, they're recommending you to isolate. and then do the second test, as I said, maybe 36 hours later to see if you are actually positive or not. But there could be scenarios. As I mentioned, antigen tests are fast, quick, easy, little bit, less expensive, but they don't have as high an accuracy. So there's always a chance you might be false positive or a false negative. And that's why you should do definitely the second test 36 hours after the first test. Okay, so I hope it makes sense. I hope it was useful to you. Please let me know any questions or comments that you have. Reach out. Connect with me on LinkedIn, engage in a conversation, share your story. If you happen to do this test, I would love to hear from you what your experience is. And again, I look forward to hearing from you. Thank you so much for your interest and attention. And I hope all of you will continue to stay safe in these difficult circumstances.